So we've done an awful lot to implement this. We're really recommending screening as many as 80 million people in the US. There are a number of different strategies that we're really going to have to use to try to do that. Our goal is to really try to identify as many persons who are HCV infected as possible, especially given the fact that 50 to 75% of them are unaware of their infection. And it's critically important that not only do we identify them, but we're able to link them to care, and for those that's appropriate, link them to treatment as well. There are a number of different things that someone can receive beyond just treatment that can really help them to reduce their risk. Simple things like being able to reduce alcohol use, reducing perhaps the use of other over-the-counter medications, perhaps getting vaccines as appropriate. There are a number of things that can happen that don't even really have to include treatment. And as you can see, there are also a number of strategies, and I won't go through all of these, but right now CDC is working to develop best practices around screening strategies like this in primary care settings. We recently worked to expand, augment the capacity of hepatitis C testing in the US through appropriated funds. We have a large public health campaign known as the No More Hepatitis Campaign, and I'll share some information about that. We're working to educate both the public as well as providers on the HCV recommendations and training, and we're also working to develop performance measures so that we certainly find that in terms of quality improvement measures, physicians tend to respond to those very quickly, and that's something that really continues to improve adoption. So here's just one study where we're looking to develop some best practices. It's called the Birth Cohort Evaluation to Advance Screening and Testing for HCV, or BEST-C. And it's really a two-stage study. And retrospectively, we just looked at what's the prevalence of persons with HCV and how many of them are being tested. And we did this in 4 large primary care settings. We've begun the prospective study now, where we are examining 3 different intervention strategies, and we're using randomized controlled trials for those so we can really get a clear sense of how effective are these strategies in being able to identify persons that have previously been unidentified. As we're working on this, we're also going to then be able to develop packages and share those with other primary care institutions that are interested in being able to implement them in their own settings as well. I'd also like to talk a little bit about the augmentation that we've been able to do for hepatitis B and C testing. We received $10 million both in 2012 and 2013 to increase testing for hepatitis B and C in the U.S. We were able to fund 35 grantees who, in just the first year alone, were able to test over 45,000 persons. And that includes ramp-up time, getting started, and they've done tremendous work, and they're now into year 2. And their testing rates are increasing, and they're really identifying a number of previously undiagnosed persons. So we're very excited about this. We also used it to fund part of our No More Hepatitis campaign, and also developed a secure web-based system that allows us to be able to track the progress and success of these different programs to make sure that we have a clear sense of monitoring and evaluation and can be accountable to the use of these funds. And so just to drill down a little bit into what this augmentation looked like, and then kind of focusing specifically on hepatitis C, we split this funding and the testing into 3 different parts. The first group was focused on 10 grantees who are working to reach out to persons who are injecting drugs to try to test them. In our second part, we specifically focused more on community health centers. And there we funded 7 grantees who were focusing more on this birth cohort, persons born from 1945 through 1965. And they were integrating these right into primary health care. As part of this, we also funded 2 sites to conduct what's referred to as Project ECHO programs. And this is where persons who have been diagnosed and are chronically infected can actually receive treatment, but are able to receive this treatment from a long distance. So really through something like telemedicine, which can dramatically increase access to care and also increase the capacity of our healthcare system to provide this treatment. Lastly, we tried to have a catch-all setting of just being able to provide HCV services in different settings, kind of beyond just what I've talked about, which would include settings like STD clinics. Dr. Pilati will be talking more about that in a moment, as well as prison settings, incarcerated settings, and others. And in there, they're also focusing on persons who inject drugs or have a history of that, as well as those persons born in the birth cohort. And now I'd like to talk a little bit about our No More Hepatitis campaign, which you may have seen, hopefully you've seen some materials for. I'll share some of that right now. It's our national multimedia campaign. It was specifically designed to increase awareness of hepatitis C and encourage testing. It has multiple elements directed both toward audience, consumers, as well as to providers. It's a multimedia campaign where we're really trying to focus on a number of different areas, and we've been very fortunate to be able to fund this with a lot of donated time and space. And so as you can see, there's news and media outreach, print and broadcast ads such as airport dioramas. We have a web presence online with the No More Hepatitis campaign where materials can be found. We also developed an online risk assessment so that anyone can go online, complete the risk assessment, and then it prints out the results of what your risks are and different questions that you can go in and talk with your physician about. We also have social media and digital outreach, partner engagement, and we had a limited digital ad buy that we were able to do as well. This was, here are just some of the sample campaign materials. You could find all of these on our website, cdc.gov/no-more-hepatitis. These materials are available for anyone. They can be downloaded, they can be printed, and so we're finding that these are being used in a number of clinics across the country in primary care settings, so that this kind of information can be given to patients as well as to physicians. Hopefully you've been able to see some of our airport dioramas. We have these, frequently they come up here in Washington, D.C., but you can see there are a number of other cities where they're available as well. And we have had tremendous success with this, primarily due to donated time and space. We've received over $11 million worth of value just in donated space for these, and I find that I see them all the time. This has been an incredibly successful campaign because it's been able to develop more than 1.2 billion different impressions related to the campaign for hepatitis C. This is tremendous reach for what is a very, for us, really kind of limited funding around a public campaign like this. So we're very excited and we're continuing to expand the campaign now. There are a number of other online medical provider information that we have. Here we have something that's related to Medscape that sets up different webinars, different training programs for physicians so they can go there, learn more information about hepatitis C, learn the types of things that they may need to do, even if they're not a treater, just understand enough to be able to go out and conduct HCV testing and make referrals as appropriate. We have a couple of different grantees, University of Washington and the University of Alabama at Birmingham, that also develop online materials. We travel down to Birmingham every so often to conduct webinars and different presentations. Then those are online on their sites as well as ours. And we provide a great deal of patient education as well. All of this education, again, is available. You can pull down any of these materials from our website. Many folks do this, and they'll print these up and then actually have them in their offices. And we find that there's something that's very helpful. Patients have been able to take that information, read about it, and then they can go in and talk with their physician about that if they're perhaps concerned that it's an infection that they might have. Thank you very much for your time and attention.